On February 29th, a family of three had arrived in the Indian state of Kerala from Italy where they lived. The trio skipped a voluntary screening for COVID-19 at the airport and took a taxi 125 miles to their home. Now, a whole week after taking off from Venice, all the three had tested positive for the virus and so had two of their elderly relatives. Post the development, the district health department was alerted, and by 3 a.m. next day, after the positive cases were confirmed, the district health team under collector had settled on a WHO recommended plan of contact tracing, isolation and surveillance. There was, however, one obstacle. The family weren't forthcoming. They were in isolation, but didn't want to declare the full extent of their moments. It was as though they were embarrassed. At this point, 31 people had tested positive for COVID-19 across the country. The collector, wasting no time, brought in 50 police officers, paramedics, and volunteers and split them into teams. Then he sent them out to retrace the family's movements over that crucial week. They have given his district officers an address here, a name there, but the task force expanded it dramatically, using GPS data mined from the family's mobile phones and surveillance footage taken from the airport, streets, and stores. That evening, Kerala's health minister, K.K. Shailaja, arrived from the state capital. The minister's arrival in the district reassured Nu, the collector. He wasn't on his own. The machinery of the entire state was at the disposal by now. The seriousness of the government was amazing. While the rest of India, along with countries such as the UK and the US, wouldn't take stringent steps to limit movement for another 2 months, Kerala minister, understanding the risk factor, had ordered Kerala's 4 international airports to start screening passengers from January. All those with symptoms were taken to a government facility where they were tested and isolated. By February, she had a 24-member state response team coordinating with the police and public officials across Kerala. On March 11th, the WHO declared the COVID-19 outbreak a pandemic. The next day, India reported its first death. Even so, the Prime Minister Modi, perhaps concerned by the impact on the economy, refused to issue public advisories and didn't address the media. But in Kerala, a different style of leadership was on display. With 15 cases now confirmed across the state, Pinarayi Vijayan, the Chief Minister of Kerala, ordered a lockdown, shutting schools, banning large gatherings, etc. The first Indian to test positive for COVID-19 was a medical student who had arrived in Kerala from Wuhan at the end of January. Even the first three corona cases in India were all reported from Kerala. Yet, the state has effectively been able to contain the virus. So far, thanks to a strong health system. The number of persons placed under the observation in the state at one instance even crossed 150,000. Kerala was also leading the way by providing relief to its people in times of an economic slowdown due to the virus, even before the Indian government announced relief measures. The state government has announced a 20,000 crore stimulus package to tide over the economic crisis, of which 500 crore is exclusively for the health sector. Another 2,000 crore was distributed to needy families through rural guarantee programs and welfare pensions. Some of the other major factors that Kerala initiated at early stages were community kitchen, scheme to feed the public and free provisions including rice, oil and spices. Chief Minister even moved up the date of state pension payments. The another factor is social distancing. The state has enforced social distancing measures and urged people to stay at home even at early Feb. Route maps. District authorities began preparing route maps of the infected people, which involves tracking every point from when the patient landed in Kerala or came in contact with an infected person. Doctors urged to cancel leaves. In an effort to maximize resources, State Health Minister K.K. Shailaja has urged all doctors and health department employees who are on leave to rejoin duty with immediate effect. Retired doctors also joined without wasting any time, which played a vital role. Awareness in community and a massive state awareness drive and preventive measures such as airport screening has proven effective. Quarantine comfort. While the center's period of quarantine is 14 days, Kerala is quarantined people for 28 days. Also, patients leaving hospitals shared positive things, giving their choices of meals being provided with the Wi-Fi, etc. Focusing on mental health. The state opened multiple call centers to keep check on the mental health of those who are home quarantined. Midday meals. The state has begun providing nutrients for midday meals to 3.75 lakh children aged between 3 and 6 at their homes. Last but not least, daily press conferences. The Kerala government holds a press conference led by Chief Minister Pinarayi Vijayan and Health Minister Shailaja every evening with answers for any questions one may have about the outbreak, including the details on new cases that have been reported. Kerala has one of the top healthcare systems in the 130 crore populated country and even have experience of tackling the deadly Nipah virus during its outbreak in 2018 and 19. Even the World Health Organization commented Kerala's strong health system and emergency preparedness that enabled it to contain the spread of Nipah virus. Another factor helped the Kerala was 95% of its illiteracy rate, the highest in India, and a vibrant local media. So far, Kerala has stuck to the script and done it well, say analysts. Cases have slowed down, recoveries are high, and the mortality rate is low, in fact, the lowest in India. They just have around 140 active cases now and strongly flattening the curve every day. As one of their doctors said, we have won the quarter-final. The semi-final would be a staggered easing up without a second wave of infection, and the final would be a return to normal life. Only then we can say we won the game.